Hello, everyone. I'm Leslie Cornwell, certified nurse midwife with Empowering Midwifery Education. This section is cultural competency and bias training. This presentation is for informational use only, not intended to substitute for professional, legal, or clinical advice. We strive to keep our information as accurate and timely as possible, but make no promises and guarantees it works for your local unique situation. Course objectives, the students will be able to verbalize why cultural competency and bias training is really important. They'll be able to verbalize the different aspects of cultural competency, personal biases within the healthcare sector. The student will be able to verbalize how personal and implicit bias influences your decision making, your everyday, day-to-day life interactions. The students will be able to verbalize what are some strategies to overcome personal biases in decision making. And you'll be able to kind of catch and at least be able to acknowledge when biases are in place. The students will be able to verbalize the importance of implementing cultural competency within their healthcare service. We really want to make sure, I think it's drilled more and more and more every day, cultural competency. And I think it's really about just understanding the person's culture and the situation that you're taking care of. It's not just understanding Hispanic and African American and the Amish Mennonite and the community you're serving families in the hospital, birth center, home, in the different parts of the country. There's tons of cultures everywhere. And it's hard because sometimes we're raised and grown with our viewpoints and our perceptions of safety and how things are done best. And we always have to come down to, is it a bias? Is it our perception? Is it evidence? When is it a safety issue? And when is this a cultural preference? Because I think sometimes in today's society, medical autonomy over one's body and choices and rights and options, even when you're showing someone the best way to make a decision for them, we have to be careful of our own biases in that informed consent process. So the whole point of these trainings is just to really make acknowledgement. You're not going to be an expert in cultural competency. You're going to get good at serving the community that you want to serve and how you want to serve them, but you also want to be able to acknowledge whatever situation you're in your personal life and working, you're always going to have biases present, and you have to be able to pause and acknowledge, is this something that's a bias of mine, or is it something that is the standard and evidence that you want to be able to really look at when you have biases and you're given suggestions and ideas that are maybe influenced more by your personal viewpoints, whether it's controversial topics of choosing a home birth, choosing circumcision, choosing vaccinations, choosing to decline a testing. We always have to be careful when we're discussing things with our families and being honest, like, this is my personal opinion, this is how I did things, this is what the evidence shows, here's your options. We have to be very honest and reinforce that the families and the patients you're serving have autonomy over their choices and rights, and what are your personal biases, but it's not going to impact how you serve them and care for them, whatever decision they pick. So having inclusivity, having a respectful place, having shared decision making where you're truly giving the risk and benefits and options and alternatives and mainstream and national guidelines, international guidelines, newest evidence. Maybe there's not a lot of data, and you try to make it in a Cliff Note version so they can make decisions. Even just simple things of how you take care of people. You may not be saying anything and having a discussion, but your biases come out with how you take care of people. If you've been in the hospital setting, labor and delivery nurse, became a nurse midwife, and then wanted to do home births, you're going to have a cultural bias of how birth goes because you're used to and conditioned to a certain programming and conditioning of what is normal. If you're someone that's in the community-based setting and you've only done home, and then all of a sudden you do a transfer and your patient is now in the hospital, you're going to have a bias of how they're taking care of that person. And you have to be careful when we're trying to advocate for these clients in these tough situations where there are biases on both sides of the providers kind of coming together. So we have to really think about the patient we're serving and how we're serving with our biases that are in place. Understanding cultural competency is so important in healthcare. It affects the decisions your patient makes. The word compliant drives me crazy. Are they going to follow up with you? Are they going to do what they say they're going to do? Are they going to just abandon the healthcare system because they felt too much biases were on them? And it shocked me, the data of how many people say to their practitioners, yeah, I'll get that prescription. Yep. But they actually don't pick it up. So that tells me a lot lot that we aren't listening. We're putting our biases in. Our patient can't feel empowered to truly say what they're thinking in front of us because of our authoritarian figure, because of our respect for us, because of our viewpoints and beliefs. Patients truly are not able to always say and advocate for themselves based on their cultural preferences and their beliefs and what they're looking for if it's not a safe space that we can provide that to them. Cultural competency is in healthcare essential for providing effective, high quality care around all diverse populations. It's tailoring our healthcare services to their unique needs and their unique situation. It's not their skin, it's not their religion, it's not their age. We have to make, yes, we can stereotype and we can have assumptions about how they want to be taken care of, but a simple open-ended question: what are your preferences and beliefs? Do you have a birth plan? What do you think about birth? What do you think about pregnancy? What is your educational level? How much research have you done? What questions do you have? You're going to be able to give them the floor and the opportunity, but it takes time. The average busier healthcare system doesn't have the time to give the patients for those discussions and give them the power of the conversations, the flow of the care to be able to do that. Cultural competency is being able to do some of the best practices for implementing it is providing an interpreter if it's a language barrier, having a diverse staff so that there are people with different viewpoints and perspectives. If you have everybody from the same culture and belief system serving a culturally diverse practice, it makes it harder. But I will challenge you, if you're a Jewish midwife and you have Jewish birth assistants and you're serving a Jewish community, that may work perfectly fine for you. But if you're going to serve to the public and you've got women of all aspects of backgrounds and beliefs and resources, you have to do some training and education of the people you're going to serve. How are you going to serve them? We just opened a birth center and we're all surrounded by an Indian community, and for me to network and to approach is going to be very different than when I go to the yoga studio and when I go to a Catholic congregation. So you have to be able to, when you're networking, when you're serving them, when they call for questions, when each of these communities are reaching out and wanting care with your practice, you've got to have a good sense of just baselines, and don't just read in a book. Ask the leaders of those communities. Be open, be honest. What are the preferences? Are they more conservative? Are they more progressive? What are people's needs and how can we serve them? Just asking simple questions and learning offers that respectful, fostering community to open up those dialogue and conversations. You're not going to be able to memorize every cultural preference, and then you start stereotyping and making assumptions of how they're going to act and respond. You need to have individualized healthcare. That person, not based on their skin and making assumptions about them and their beliefs, you need to just ask what are their references. And that's part of our value as being midwives and practitioners. We get to build that relationship. We get to build that trust. We get to know them well. And what are their beliefs? What are their biases? What is their educational level? Personal biases, I think, are a lot harder because it's a subconscious thing. If you're not pausing and just at least, you may or may not be able to tell if it's a bias, but you can pause and you can just think about it. Am I bringing my bias into this conversation? Is it a safety issue? Is there an education barrier? What does the data say? Where are we at with things? Because especially nowadays with post-COVID, with a lot of viewpoints and extreme beliefs in our healthcare system and our providers, there's a lot of patients feeling abandoned from one side of the system to the other because of these personal biases, because of the viewpoints of how to take care of people occurring on many, many levels. There are different types of bias. There's explicit and implicit. Explicit is the attitude and assumptions we have, and the implicit is the ones that people are really not aware of. And I challenge that they may be aware, but sometimes it's just subconscious. It comes out. It can be on an institutional level with their mission and their vision and how they serve people. It could be on a person-to-person interaction. You're interviewing people to join your team. You're hiring staff. You're training. You're talking on the phone with a new client. You're sitting at the bedside with them. You're doing a home visit. You're going to have biases and viewpoints and beliefs that are going to come out and trigger things on every level. And we try the best of our ability to keep our personal bias out, but it's going to happen and it's going to be part. So how do personal biases, including implicit, influence your decision making? I mean, we could spend hours and hours talking about the conversation. My goal is high level, just to get people to start thinking about these, not to tell you every hypothetical situation because there's millions of them. In a few seconds of conversations, we have lots of biases and assumptions about how they look and what's surrounding, how they're presented, how they're sitting, how they're talking. We're making, I mean, that's a biological, instinctual thing. We come down to, is this safe situation? Is this someone I can trust? Is this someone that's going to quote unquote eat me because of our safety, that spidey sense you're feeling? So biases have a protective mechanism in many, many years ago, but in today's society and culture, it tends to come out in conversations and relationships and viewpoints and beliefs more than it does for like a safety thing of what it was designed for. So, personal implicit biases refers to negative attitudes towards specific social groups that individuals may not consciously recognize. And I wouldn't even say a negative. It could be positive, it could be negative, but you're making assumptions. That's the whole point of biases. They're shaped by your experiences. So, if you had a traumatic experience with an African American person that you got mugged at a bar, you may be a little more jumpy around African American men, and that is your bias and beliefs. If you've had a trauma with a certain situation of a birth, and now this woman is getting triggered every single time you have someone of similar stature and demeanor and situation, you're going to get triggered. And so you have to be able to pause and acknowledge that. And when you start getting anxious and you're starting to say things, we really have to step and pause. And it's okay to have biases. It's just making sure that our viewpoints aren't affecting that person, and narrowing down their choices and options of care based on our personal viewpoints and biases. Personal biases, implicit biases, can significantly influence the decision-making process. They're often unconscious, and they can lead to irrational decision-making. The more anxious, the more stressed you are, the more those biases come out, and you sometimes don't even realize. Some of the common ways that biases influence decision-making process: anchoring biases. Decision makers often rely heavily on information during the encounter. Their history, someone put on their diagnosis they're non-compliant, they've transferred a bunch of times, they've done a bunch of drugs, they've had a lot of STDs, they are young and have had 3 babies before. Like, we make decisions and assumptions based on that person purely because of what we're reading and interpreting that based on our beliefs. Confirmation bias is when we tend to seek and favor people that have our pre-existing beliefs, and then dismissing contradictory evidence and reinforcing that preference bias in that world. Especially with social media and everything now, it's reinforcing that confirmation bias. The AI, the artificial intelligence, is specifically conditioning confirmation biases and causing divides and separations so that people can't understand each other. They can't come to the table because they're just surrounding people more and more, and information and things on these online platforms around what's reinforcing that existing belief. Similarity bias is decision makers prefer those similar to them, influencing their judgment. So if you tend to want to hang out with people that have the same beliefs you do, you're just going to compound on that. Experience bias is quick decision making, rush to judgment without considering all the facts based on you've had this past experience before, so you think it's going to go that way again. You've had this past birth trauma, it's starting to go that same way that other birth went, and you start, maybe it will impact how you make decision making during labor. Are you going to transfer faster? Are you going to give a medication before? She's had 3 postpartum hemorrhages and it's starting to go that pathway again. Is the evidence there to do the extra interventions, or is it the fear of what's happened in the past causing you to make the decisions you're making? Overconfidence bias is individuals may be overly optimistic about their abilities, their skills, and leads to poor decision making and missing valuable input because they think they know it all, and they're not really looking at the whole situation. They're not listening to everyone on the team. They're not listening to their patient when their patient tells them the baby's coming, and they have been doing it for a very long time, and they don't think based on the situation. And I just checked your service it was 2 centimeters 20 minutes ago. There's no way you're having a baby. So there's these, sometimes happens as a midwife. I've seen this so many times. I've been doing it for many years. It's your first baby. There's no way you just started labor 2 hours ago and you're going to have this baby based on what you're saying to me. So we have to be super careful and not making assumptions and having bad outcomes happen because we're using our past experience to push onto that other person's. And it's difficult. It's very, very difficult. I'm not saying anybody can really avoid biases. Their brains are programmed that way, but we just have to be careful of how are we utilizing them and acknowledging them. Biases can lead to flawed decision making, hindering effective problem solving, impacting interactions with others. We really need to be able to recognize and address these biases, especially if they're really causing safety issues. They're allowing it so that people cannot openly discuss their concerns and problems and get the best treatment for them. We have to make sure that our personal biases and beliefs are not impacting that person's care. Here's some of the different strategies we can do to overcome personal biases in the making process. You can increase self awareness. You can recognize and understand during personal interactions your judgment, your responses. Educating yourself on a cognitive bias level, you can really just start learning was that evidence? Was that a belief? What was it that came out from that response? And just being recognition more in the moment of the things you're saying and how they impact people. Soliciting advice and feedback, asking people, your colleagues, your friends, warm, safe, supportive spaces, what biases do I have? What assumptions do I make? And you might be surprised what people say to you, but you want to make sure you're asking people that are going to be truly honest and want to help you grow, versus it's a sensitive matter to be critiqued on any level, especially about our subconscious biases. Create structure and evaluation processes to help with the decision. If you have a risk benefits informed consent, everybody goes over. It helps to keep the biases out. If there's certain educational handouts that everybody agreed on and created together based on references and datas, you're going to chart and we have policies and guidelines and protocols that are made as a team. And if you're going to deviate out of them, you've got some evidence, you've got some decision, maybe the cultural preferences of the client change the plan and the care standards. Having outside objective reviews of your charts, your services. Patient surveys are really valuable, especially if they're anonymous. You can really get a sense of, you may think you're very culturally competent, but if you're getting a survey over and over again from certain populations that you don't get me, you weren't listening to me, I felt like I didn't have choices in the options of my care, you need to be really reevaluating how your cultural competency and biases are coming out. Normalize bias discussions. It's not a bad thing. It's not this, we have a taboo feeling of so many of these conversations, and we need to be able to open and have dialogue and discussion, or we can improve. Like when we do stuff right and wrong, we've got to get consistently having conversations. Whether we did positive things and we got great compliments, or we have areas of improvement. Whether we do staff meetings, we do yearly reviews for our staff, and we're giving them raises, or we're considering hiring people. We have disciplinary things. You want to foster a space where those open conversations of the biases, the concerns, and really promoting awareness, inclusivity. Focus on your patient's strengths, focus on their knowledge, their education level, get your information to be customized to what their needs are. If there's someone that's more engineering based, they like the numbers, they like high level, you've got someone with an 8th grade reading level, you're going to focus and customize your education and the content you're giving. You don't want to be talking over people, but you don't want to be too simplistic in your discussion. Your care, even how you stand and you're around and interacting with your patient, shows them, are you open to conversations or you're closed? Because if you just stand at the door and you say, do you need anything else, as your hand is on the door and you're about ready to walk out, you're not really open. Your body speaks louder than words. You may not have the intention to make the patient feel rushed, but if you're sitting next to them, you're casual, you're relaxed, and you ask, hey, is there anything else I can help you with? You're going to get a very different response from your patient versus you're already walking to the door. Oh yeah, is there anything else you need? They're not going to tell you that because they know you're busy and you're already leaving. So we need to implement these strategies. We need to really think about, how do we sit? How do we present ourselves? How are we acting? If you're constantly glancing at your phone or glancing at the clock, they know you're anxious to get somewhere else and distracted. You're not fully present. So the eye contact, the relationship, the discussion, how you present things. I like to use a little humor. It makes people are nervous being there, especially if they're there for a well woman visit, a PAP. They're half naked, anxious can be. You're going to stick a speculum in their vagina. And we do this all the time. We want to make it a lighthearted, comfortable situation when it's culturally appropriate. Implementing cultural competency trainings within Healthcare is so important. You want to provide on a bigger hospital system and small scale. You can get with a lot of these EHR systems in the community center, interpreters, you can get online systems. You can have, if you're a larger practice, hiring staff that's dual language and help with those barriers of who you're serving. You can get a full-time interpreter. You can have a lot of minority staff within your practice, retraining them, recruiting them. So you have a lot of different viewpoints and different communities you can serve with your care. You want to have trainings just like this one so that there's just awareness, recognition, depending on who you serve, how you're going to serve them, and what are the expectations of the team, your mission and vision. Coordinate with community resources. If there's certain cultural needs that need to be addressed that you can't do for them, know who in the area is the best one to connect them with. Integrate cultural competency on an educational level when they start their trainings, regular reviews, high expectations in their evaluations. Your customer service is going to address it. You want to make sure it's an ongoing process that everybody is on the same page. You're giving high quality cultural competence care. Establish institutional frameworks. Those are those missions, those visions, those policies, those procedures, those expectations for your staff, how people are acting, how they're being held accountable, and being called out in a respectful way if you know that wasn't the best way to have that conversation with that patient based on your viewpoints, your biases, your assumptions. We need to really talk about this and have a conversation, because I notice when you have a visit with patients of this ethnicity, they don't tend to want to be on your schedule and have you take care of them during birth because of how uncomfortable you make them feel. And so let's have a discussion about this, and let's learn what about those conversations, what about the discussions. Are there biases? Is there a lack of education? We need to have a discussion about this. So as an overall conclusion, cultural competency and addressing biases are fundamental for fostering inclusivity, equity, and fairness across all societies, genders, cultural beliefs that we're taking care of. There's many reasons for that. We want to promote diversity and inclusion so that we can improve outcomes, we can better the communities we're serving in a respectful and healthy way. We want to enhance collaboration within the community based on a professional level, based on the clients we're serving, based on our staff, based on the doctors in the hospital and the nurses and the midwives, our colleagues we're working side by side with. We want to reduce discrimination and biases. We want to address those biases and reduce the discriminatory behaviors so we can promote a fair decision-making process, whether it's between our patients, whether it's a decision in the office and practice. We're making those decisions as a team. You want to improve customer and client relationships when they're more empowered to make the best decisions for them and they're in a comfortable, safe space that they can truly open up about their concerns and wishes versus they smile and nod because they don't feel like they can be comfortable with you based on your biases and beliefs and being part of a certain system or stigma or assumptions. Enhancing organizational performance, you want to foster an environment that there's engagement, there's value, there's inclusive trainings in a space where everybody's voice, no matter their beliefs and viewpoints, are being heard and acknowledged. They want to have addressing health disparities. So you want to be able to communicate and allow patients to truly have that discussion where they can trust and really open up to. So the example I gave was the high amount of prescriptions that the patients say yes, yes, or they just listen, but don't actually go get filled because they really didn't want to take it or they're not comfortable or they didn't understand, but they couldn't have that conversation with their care provider because of the biases and the trusts and the barriers that are in place. Ultimately, embracing cultural diversity and challenging those biases leads to more just, inclusive, and harmonious society, allowing for more opportunities for less burnout, happier workplace, better patient outcomes, regardless of their background or their identity.